Well, good morning, everyone. This is Keith with Positively Osceola, another one of our Daybreak live shows. And we have some amazing guests that we are super honored to be able to speak to, and we never take it for granted. We're going to kind of just start off casual as the wonder of Facebook. As I say, in Zuck, we trust Mr. Zuckerberg. We'll give a little casual welcome real quick, and then we'll do the real deal and make it kind of official. But this morning, we are super blessed to have Candace Kirkland, Linda Moyers, and of course, the one and only Jeremy Lanier. How are you guys doing?
Good. We're great. Happy to be here.
Doing well, no complaints at all. And, we have a good time every day doing these things a few times a day. And I look back now, I'm not sure how we ever communicated to anybody without having the availability to do this. It was much more complicated prior to how we're doing it now, but
Great.
So is it 100 degrees where you are right now?
Almost.
It's there. I think we're very fortunate to be inside air-conditioned facilities. So yeah, but it is going to be a hot one today.
What's amazing in just a few months, we'll go to a convenience store and someone will say, "Oh my gosh, it's freezing out. I wish it would warm up again."
That's the beauty of Florida.
It is. All right, so we got a few people popping on here. Let's make it official. What do you say?
Yes, let's do it.
Here we go. Well, again, so this is the official welcome this morning. Positively Osceola's Daybreak Live, and some great information we're going to share. So if you're popping on, we really recommend that you stay. I'm going to introduce our guests right now, and everyone really from the Florida Department of Health in Osceola County. And this morning we have Candace Kirkland from FDOH-Osceola, Breastfeeding and Peer Counseling Coordinator for WIC and Nutrition Services in Osceola County. She's also an international board certified lactation consultant. I also have this morning Linda Moyers, also from FDOH, Osceola International Board certified lactation consultant for WIC and Nutrition Services in Osceola County. And as I introduced earlier, the one and only Jeremy Lanier, Public Information Officer for the Florida Department of Health in Osceola County. And a cool thing to mention is I memorized all of that.
Very good.
Not even close, but it's more about accuracy as opposed to memorization skills, is it not? So thank you for coming. Obviously, you're all very super busy, and so we appreciate you taking the time out of your morning and hanging out with us. And so we talked about this a little bit earlier. When we speak to Florida Department of Health in Osceola County, I think the assumption is that we're going to speak about COVID-19, and we will for sure as we go through this today. But I think, that's dominated the messaging for sure, and rightfully so. But we don't want to forget that there are so many things that you provide in the way of services for the community, for those who need services provided to them. And it's very important. It's about life. And I think the COVID-19 topic is not the only topic. And you do so much for all of us in the community. So today, hopefully, will be an opportunity where you'll be able to share some of the other things you're doing, specifically as we approach World Breastfeeding Week, which is August 1st through 7th. So you guys can pick who speaks first, either Candace or Linda, but let us know what's going on as far as the World Breastfeeding Week and what those services are connected to that you provide day in and day out.
Okay. Well, here at the Health Department in the WIC office, we offer free breastfeeding classes for pregnant women. We have free breastfeeding consults with a lactation consultant, and we provide ongoing support with breastfeeding peer counselors who contact the moms monthly and closer to their due dates and after they have the baby throughout the time that they're breastfeeding to continue the support. And we also have we support moms that are going back to work. We have pumps available for those that qualify so that they can continue to provide breast milk for their babies. So we're here to help Osceola County prenatal moms and breastfeeding moms.
That's wonderful, Candace. That's true. We do those types of things day in and day out. And I think that, we want people to know about it because some of the benefits of breastfeeding that maybe people won't know about even.
Yeah, definitely for moms and babies, the connection with the mom and baby when they're breastfeeding. Breastfed babies are definitely healthier. They're less likely to become sick overall, less likely to have ear infections, asthma, just to name a few. For moms, they're less likely to, they're lower risk of having ovarian cancer and breast cancer, and many more. There's lots of benefits to breastfeeding.
Yeah, we've even said if there was any time to breastfeed, now is the time, ladies. With COVID out there, your breast milk, when you get your vaccine, your breast milk will transfer some of those antibodies to the baby. Even if you get sick, it's recommended that you continue to breastfeed because your body is making antibodies to protect your baby. So we want to make sure that everybody knows that that it's very, very important during any emergencies, especially with this one here now. If you were thinking about it, weren't sure about it, please come and talk to one of us. We have wonderful, dedicated people here. I know that Candace and myself have been here for many years. We have peer counselors who have been here for over 15 years. We have others that are certified lactation counselors as well. And it's a pretty tight-knit group because we all feel like the things that we have to say or things that we want to talk to mothers about is to help them reach their goals. We don't have a preconceived idea of what they need to do. It's just that we know, well, what is it, like 90% of the moms start breastfeeding in Osceola County, and then as the months go on, it starts to dwindle. So we want you to know that that kind of leads into the shared responsibility. Do you want me to talk to them about this? World Breastfeeding Week, what we do every year is we celebrate along with the rest of the world World Breastfeeding Week. This has been going on since 1992. And every year there's a theme. And this year the theme is Protect Breastfeeding, a Shared Responsibility. And basically, we want to get the word out to everybody. It's not just the mom. When you see a mom and maybe she stopped breastfeeding early or she ran into some problems, let's not put all the blame on the family. Okay, we have to look around at ourselves, our community, what's going on and what we can do to share the responsibility to help mothers be more successful, because like Candace mentioned, this is very good, not just for the children, but also for the mothers, and it's good for the rest of the community too. So what kind of things are we doing during World Breastfeeding Week to talk about this, and why is it important? Who else is it that's a player here? Well, like we mentioned, if we look at within our own community, do we frown upon moms we see breastfeeding? Legally, they are allowed to breastfeed their baby any place that they and their baby are allowed to be. And this right is protected by the law. And it is a child's right to be breastfed. So when you see a breastfeeding mom, tell her she's doing a great job, okay? Little things like that. What else is going on in the community? You go over, you have to go back to work sometime. Well, when you go back to work, you can't just not breastfeed for 8 hours because your milk is continuous. So there are some laws now that have been put into place that allow working mothers time to breastfeed their babies, or to pump for their babies. So that ties in with part of the program you mentioned about the pumps.
Yes, we do have pumps available for those moms, and definitely reach out to us if you are interested.
Yeah, and not only do we just hand it to you, we could talk to you about it, teach you how to use it, how to handle and store breast milk, that type of thing. If you look at the community as a whole, things like maternity and paternity leave, those type of things help protect the breastfeeding relationship. It's hard to have to decide whether to put food in the baby's mouth or put food on the table. And when our county, which is not the richest county in the world, has to make that decision, unfortunately, many times breastfeeding goes out the door. So we're looking at what other structures are in place. What are we doing as a community, as a workforce, as a county, as a nation? What is the world doing? What kind of things are happening to put breastfeeding, to give breastfeeding kind of the protection it needs? for these families to get off to a good start. So we're excited about World Breastfeeding Week, and we're doing a few things here in order to explain more about it to people. This is some information from WABA, which is the World Alliance for Breastfeeding Action. Every mom is going to be getting one of these sheets along with a little letter from Candace to them about World Breastfeeding Week. We're inviting them to come to our office, and that's going to be August 6th at the Fortune Road office in Kissimmee. We have a photo booth that Candace does a brainstorm with this one. It's really cute. It's very glitzy. We have a photo booth. We even have photo props, and this is for moms to come, or pregnant moms. They can have a selfie taken, and we got a lot of these props. The peer talking about our counselors, they're wonderful. They've created so much of this, and they also helped us create a wonderful giveaway that we have this year because we need to be very concerned about COVID. So our department, the breastfeed department, actually hand tie-dyed these little masks, and on here, it's hard to see it, but this is the emblem right here, the logo.
I can see it.
For this year's World Breastfeeding Week. Okay, and on there's a mom and a dad and baby. It says protect breastfeeding, a shared responsibility, and World Breastfeeding Week 2021 WABA, for the World Action. Okay, so they get a certificate to the moms because we're proud of them, saying they're outstanding moms.
Awesome.
They get to talk to us, which is always fun, right? And
I'm liking it.
Counselors. So I don't know. We're talking to the hospitals. We're talking to some of the organizations in town. We're sharing our literature. Mm-hmm.
So let me ask you. So have, and this may sound a bit too simplistic. So from where I sit, and again, that's not not from where you sit. I think our culture has changed maybe over the last 10 years, I would say, if that's correct or not. Some of you see obviously respect being paid to the moms in airports and many more public areas, certainly. So do you think our culture has, I guess, evolved to help that this is part of our culture and we understand more that it's not something we should, turn our heads. It's part of life. It's a part of health. It's a part of future health for our kids. Do you think we've changed a bit for the good?
Oh, yes. I know when I first started with breastfeeding, helping people with breastfeeding. Do you mind if I tell them a little bit? Okay. I started out over 30 years ago, and I was a volunteer Lactation League leader. And at that time, Lactation League was one of the only games in town as far as moms being able to get support about breastfeeding. When I first joined the health department, probably 27 years ago, we had an initiation rate of like 36% of moms who are breastfeeding. Now it's like 90%. And it's not just because I joined the health department by any stretch. What happened over these years is we've seen things like baby-friendly hospitals come into being. You could go online and you could see all kinds of things about breastfeeding. There are the different hospitals are having opportunities where they're teaching and they're training their staff, and they're having lactation counselors or consultants on staff in order to provide this kind of help. Laws are being enacted. We have organizations in Florida that go to Tallahassee, who talk to the representatives there, who bring to light the issues that many people would never think of, and that's how some things are happening. The Surgeon General had a call to action about breastfeeding. So it's like fantastic. People are getting on board. So we just want to keep that momentum going and bring it back to Osceola County also to remind all the people involved with anybody who's pregnant, who's with babies, who's with the moms, the daycare workers, handling the breast milk that moms provide, the jobs that the people have, all the different sectors we talked about before. And it's fantastic. You're right. You could get information in so many places, which is wonderful. Absolutely wonderful.
So Candace, from where you're sitting, have you seen, has COVID made it very challenging for you to get that messaging out? I'm going to assume it has created some more difficulty, but Candace, let us know, what are you seeing in the way of less or more people coming for these services, please?
We've been helping even throughout the whole COVID. We still we recently just started letting clients come back in the offices, but breastfeeding team, we have been still seeing the clients, doing the best we can. Yes, it has been less moms coming in. They've been afraid, but we've met them at their cars. We do, of course, social distancing. We have been still issuing pumps. We've been helping with moms that have premature babies because they need a special kind of pump.
Sure.
We help with those. We lend those out. Yes. So we have seen less moms, but doing a lot of trying. It is challenging trying to help do a consult over the phone rather than in person, and also even when we're in person, keeping that social distance from them. That's why we have a lot of props. This is our baby, which we do use a lot to help to show moms how to latch the baby on, and we'll show different positions with the baby. And we do use that a lot. So
We've been initiated a mail out also. Right. Candace's guidance that we're sending to pregnant moms. The peer counselors are giving us information, and the nutrition staff is very involved, giving us information about moms who are pregnant.
Yeah, because a lot of things are still over the phone, but we are seeing clients in person, and we get a lot of referrals from nutrition staff, and we reach out to these moms, and then we do invite them to come in, and they have been coming in more now, and we're able to see them in a private setting since we are allowed to bring back to our offices now instead of meeting them in the car.
So my thought is, if what would be a great solution would be for people to not assume that they can't gain information from you right now, because I think that happens a lot in every part of our community. People assume, oh, that's not happening right now because of COVID. It's just not going to happen. I'm going to lose out on this, and then they put it aside. But that's not what you probably want. I'm sure that you want them to call, that you want them to research and connect with you. Once they connect with you, then they know what services you can provide during this time. Would that be correct?
Yes, that's correct. Yes.
Okay. All right. Well, anything else you want to share with us as far as what you are providing in breastfeeding services?
I'm definitely very proud of all my staff. I have Linda, who's she's taught me everything I know. I have to say that. She's been here a lot longer than I have, but yes, I am the breastfeeding coordinator and an IBCLC as well. But I have Carmelita, who's one of our CLCs, and we have 3 peer counselors that 2 of them actually are CLCs too that work with moms.
Yeah, we have Maria, Leanne, and Samantha, and all of them are on the phones, calling moms, calling pregnant moms, new moms, supporting them through their journey. And they've all breastfed themselves. They're all highly trained about breastfeeding, and they give very accurate, informative information to mothers.
Awesome. So for those who may have popped in, anybody who would be interested in learning more about breastfeeding, the services that you provide at the Florida Department of Health in Osceola County, you see the phone number right there, a couple of websites you can also pursue, and of course, osceola.floridahealth.gov, always is steeped with information in all kinds of health-related services, and of course in breastfeeding. And I know my son breastfed, and my wife and I look back at it often and say, we really attribute that his health. He's just never sick, and we always look back at it and say, hey, that was a great decision. So we were very, very grateful that could be a possibility. So encouraging people, look into this, and where the resources are here in Osceola County. It's right at the FDOH in Osceola County. So I thank both of you for being here this morning.
You're very welcome.
Thank you. Thank you for having us.
Even with masks on, it was a ton of information shared this morning.
Thank you.
Hey, don't want to lose the opportunity to speak to Jeremy Lanier this morning. I know everything is, I don't think we've had a conversation in a year and a half that hasn't had the word COVID in it. So why should this one be any different? Hey, I want you to, if you don't mind, I'm going to segue. I'm going to play a quick little short video from Florida Department of Health that I think will segue in real well. Is that okay?
Yes, absolutely.
All right, here you go.
Floridians are fighting back.
We are coming together to do our part.
Getting a vaccine can protect not only you, but your loved ones too.
It's easy,
it's safe,
and it's effective.
It doesn't matter where you live or what you do for a living.
If you are eligible to receive a vaccine, there's a vaccine available for you.
As we get back to normal,
Let's do this together.
Of course, if you're a UCF Knight fan, just sub in the different coach, sub in the different stadium. Charge on, you know, go get vaccinated, charge on. Anyway, so Jeremy, Public Information Officer over at the Florida Department of Health in Osceola County, why don't you update us in the way of testing and vaccinations, please?
Absolutely. Well, first of all, I wanted to thank you, Positively Osceola, Keith, for having our amazing WIC breastfeeding team on your show this morning. We are honored. And as you can see, we have an incredible staff. Candace are prime examples of the talent that we have here at our health department, our whole WIC breastfeeding team. And as we transition through this COVID-19 pandemic, it's important to remember all of the services that our health department provides. Unfortunately, in the forefront, as you said, COVID-19 testing and vaccinations have been on the top of everyone's list, at least here at our health department. And so what we're reminding everyone is that as we've seen an increase in documented new cases and an increase in our percent positive, it is vitally important for everyone to have access to science-based information on COVID-19 vaccinations that will allow them to make the very personal decision as to whether they want to get vaccinated. So what we've done here at our health department is provided COVID-19 vaccinations by appointment and testing by appointment. So individuals who are interested in getting either testing or vaccinations can call our call center at 407-552-0120 to schedule an appointment. There are a number of reasons why individuals in Osceola County should consider getting vaccinated. Vaccinations significantly reduce the chance of transmission of the virus. They also significantly reduce the chance of severe illness, of hospitalization, and death. And as we're fighting emerging variants that are in our community that are more contagious, it is important that we also adhere to any of the prevention measures we've heard since the beginning of this pandemic, which include hand washing, some social distancing, and the use of cloth-based coverings whenever appropriate. And here at our health department, the county had required that all of our Osceola County buildings, including the health department, all of our staff use cloth-based coverings. And so we wear our masks when we're here at our health department. And we hope that individuals throughout the community consider doing so when they're in areas where it's warranted. That being said, vaccinations continue here at our health department. I'm proud to say that over 63% of our community, those 12 years and older, have at least received one vaccination. And it's encouraging to see. We encourage everyone to, again, just access trusted sources of information, including our health department. Our website is always available at osceola.floridahealth.gov. And so if there's ever any questions or concerns about vaccinations, individuals can reach out to me. I'm always available to provide guidance as needed. Another thing I'd love to share with everyone is recently we provided the opportunity for local businesses and organizations to request a COVID-19 vaccination event. And these events are our health department's way of working together with our community to provide local COVID-19 vaccination opportunities. So an example of businesses or organizations that could take advantage of this are hotels, large and small employers, civic and nonprofit organizations, faith-based organizations, residential complexes, private and charter schools, and the list goes on. So for those organizations or businesses that are interested in having us come out to their location and provide vaccinations to their employees, the staff that they have, they can reach out to us through our website, which again is osceola.floridahealth.gov, and they can make that request. We'll reach out to them within 24 to 48 hours. Another thing that we're doing is working with local churches. One particular event that we have coming up, Solid Rock Church in Kissimmee on August 14th from 10 a.m. to 3 p.m. we'll be providing vaccinations at their back to school event. And that's coming up on August 14th. And we're really excited about that. We're also providing outreach to local barbershops and salons to update them on ways that they can educate their employees and their staff on COVID-19 safety. We have done this in the past. We reached out to various salons and barbershops throughout Osceola County to kind of connect them to resources with regard to safety precautions in COVID-19. But we're reinitiating that contact. Barbershops and salons are places where people gather. They exchange stories, they update one another, and it's a perfect opportunity to allow barbershop and salon owners to become ambassadors for our community. So we're really excited about that. But again, thank you to Positively Osceola for always being wonderful supporters of our health department, for highlighting our WIC breastfeeding team. World Breastfeeding Week starts coming up very soon. It's August 1st through the 7th, and we're doing a variety of things internally and externally, and I just couldn't be prouder of our team.
Thank you.
Ironically, that was Jolene just asked that question, what month and what day that was. So thanks for being clairvoyant once again. Not a shock there, Jeremy. I tell you, so you guys have been full on. You have, straight up, always providing great services for the community, and then just add in a pandemic in the midst of it all. You guys have been straight up just nailing it, and that's why we wanted to really talk to you. We're glad to have you on today. I have to say, I get a kick out of the barbershop perspective, where you can get get a fade, a trim, a fade, and a vax. Can't say not creative. I guess I'll close with this. And you and I talked a little bit about having the availability or the opportunity to be able to say certain things, and that doesn't mean people are going to agree with them in any way or not. But I'll say this: I guess when I start hearing that it's flu season, I start changing my behavior a bit, and I think our family's behavior a bit, and we just don't, because you don't want to get sick, it's just simple stuff. You don't want to get sick. Life's busy, lots of responsibilities. And I think we, as a family, we look at it that way, and we have looked at it that way. Opportunity came, whatever anybody's perspective on vaccinations is, that's the beauty of America we live in. But I don't know anybody that wants to get sick. It's just not a good thing. And this has really caused unfortunate amounts of death and sickness. And so when something like that can be avoided, my encouragement is for people to really process that getting sick or getting seriously ill is not a good thing. And if there's a way to avoid that, perhaps that should be processed in our lives. And it's been complicated. It's only gotten more complicated, but that's how I feel. That's why our family chose to get vaccinated. So that's my 2 cents. Or 2.5 cents, whatever you look at it. But there you have it. So great information, everybody. I'll go through it real quick, and we want to thank. We had from everyone from Florida Department of Health in Osceola County, Candace Kirkland, Linda Moyers, both speaking of breastfeeding and the World Breastfeeding Week coming up from August 1st through the 7th. If you're looking for information, please reach out and ask these wonderful ladies how that they can help you and bring those answers. And as always, Jeremy, you're knocking out of the ballpark. Honored to have you here today, sir.
Thank you very much. We very much appreciate your support, and thank you for highlighting all of our efforts here at the health department. We're very appreciative.
Glad to do it. Again, this is Keith with Positively Osceola, along with these wonderful team members of the Florida Department of Health in Osceola County, together making a positive difference in and around Osceola County. Thanks.
Thank you.